In 2019, a 23-year-old woman in Seoul walked into a clinic carrying a photograph. Not a photograph of herself. A photograph of someone else. A face she had studied for months. Saved to 3 different folders on her phone. Shown to friends who said nothing honest and said everything kind. She wanted that face. Or as close to it as surgical precision could deliver. The consultation lasted 40 minutes. The surgery was scheduled for the following week. The cost was approximately $8,000. She paid it without hesitation. 6 weeks later, her face was different. Not dramatically. Subtly. The jaw slightly narrower. The nose slightly refined. The eyes slightly wider in appearance. She posted a photograph online. It received more engagement than anything she had ever posted before. She booked a follow-up consultation the same afternoon. This story is not unusual in South Korea. It is not unusual in Brazil, in the United States, in Turkey, in Thailand. It is becoming less unusual everywhere on Earth. And the industry enabling it is one of the fastest growing sectors in global healthcare, generating approximately $67 billion annually and projected to cross $100 billion before the end of this decade. Welcome to the global plastic surgery industry, where the product is the human body. The raw material is insecurity. And the market is, increasingly, everyone. So let us understand how this industry actually works. Not the brochure version. The structural version. Plastic surgery as a medical discipline has 2 distinct branches that the industry often deliberately blurs together. Reconstructive surgery addresses functional and medical needs. Burn victims. Cancer patients requiring tissue reconstruction. Children born with cleft palates. Accident survivors. This is medicine by any reasonable definition. Cosmetic surgery addresses appearance in people with no medical condition requiring intervention. This is elective. This is where the $67 billion primarily lies. And this is what has transformed from a niche luxury into a global consumer product in the space of roughly 20 years. The most performed cosmetic procedures globally are not dramatic transformations. They are incremental adjustments. Rhinoplasty, reshaping the nose, is consistently among the top 5 surgical procedures worldwide. Blepharoplasty, eyelid surgery, is particularly prevalent across East and Southeast Asia. Breast augmentation remains the single most performed cosmetic surgical procedure globally. Liposuction and abdominoplasty, body contouring procedures, round out the top tier. Then there is the non-surgical category. Botox injections, dermal fillers, chemical peels, laser treatments. These generate enormous revenue with lower procedural risk and faster turnaround. The non-surgical aesthetics market is growing faster than the surgical segment and is projected to reach $40 billion independently by 2030. The geography of cosmetic surgery reveals something interesting about how beauty standards and economic aspiration intersect globally. The United States performs the highest absolute number of cosmetic procedures annually. Approximately 4.5 million surgical procedures per year. But on a per capita basis, South Korea leads the world. Estimates suggest that between 1 in 5 and 1 in 3 South Korean women in urban areas have had at least one cosmetic procedure. The country has an entire district in Seoul, Gangnam, with the highest concentration of plastic surgery clinics per square kilometer anywhere on Earth. Brazil is the 2nd largest cosmetic surgery market globally by volume. The country has more board-certified plastic surgeons per capita than almost anywhere else in the world. Cosmetic surgery there carries less social stigma than in most Western markets. It is discussed openly, planned publicly, treated as a routine investment in personal presentation. Turkey has become the dominant destination for medical tourism in cosmetic procedures. Istanbul alone attracts hundreds of thousands of international patients annually. A rhinoplasty that costs $15,000 in the United Kingdom costs $3,000 in Istanbul, including flights and hotel. That price differential is reshaping the entire industry. And it is creating consequences that the before and after photographs.
Let us talk about the mathematics of cosmetic surgery complications. Every surgical procedure carries risk. Infection. Adverse anesthesia reactions. Nerve damage. Asymmetry. Scarring. Outcomes that require revision. These risks exist in every operating room in every country regardless of the surgeon's credentials. The complication rate for elective cosmetic surgery performed by qualified surgeons in accredited facilities is generally low. Studies consistently place serious complication rates below 2% for most standard procedures. 2% sounds reassuring. Applied to $67 billion worth of annual procedures performed on tens of millions of patients, 2% is an enormous absolute number of people experiencing serious complications every year. And not all procedures are performed by qualified surgeons in accredited facilities. This is where the global cosmetic surgery industry has a problem it has not solved and in many cases has not seriously attempted to solve. Medical tourism for cosmetic procedures operates in a regulatory gray zone that is widening as demand increases. A patient who travels from Germany to Thailand for a rhinoplasty and experiences complications returns to Germany for treatment. The German healthcare system absorbs the cost. The Thai clinic bears no liability. The patient navigated the entire transaction through Instagram before speaking to a medical professional. This scenario is not edge case. National health services in the United Kingdom, Australia, and several European countries have published data on increasing rates of patients presenting with complications from procedures performed abroad. The United Kingdom's National Health Service estimated it spends tens of millions of pounds annually treating complications from overseas cosmetic procedures. Research published in medical journals has tracked a direct correlation between increased social media use and increased rates of body dysmorphic disorder consultations at cosmetic surgery clinics. Selfie culture, augmented reality filters that alter facial proportions in real time, and the constant visual comparison enabled by platforms designed around image sharing have created a demand environment that did not exist 20 years ago. Surgeons have named specific phenomena. The Snapchat dysmorphia concept, documented in peer-reviewed literature, describes patients requesting it as a mathematically altered version of themselves. They want surgery to match a digital distortion. Some practitioners maintain strict psychological screening protocols and decline patients showing signs of unrealistic expectations or body dysmorphic disorder. Others do not. The cosmetic surgery regulation landscape globally is fragmented in ways that create significant patient risk. In the United States, any licensed physician can legally perform cosmetic surgery regardless of specialty training. Board certification in plastic surgery is not legally required to perform plastic surgery in most American states. In the United Kingdom, regulations tightened significantly following a major breast implant scandal involving substandard implants distributed across Europe. Settings ranging from dedicated clinics to hair salons. South Korea has the most developed regulatory framework for cosmetic surgery, reflecting the industry's scale in that market. Mandatory cooling-off periods before certain procedures. Required psychological consultations for patients under a certain age. Stricter advertising restrictions. The rest of the world has not followed that model. Now here is the economic layer that sits underneath all of this. The cosmetic surgery industry is not a passive responder to existing demand. It is an active creator of new demand. Marketing budgets are substantial. Social media advertising by clinics and practitioners targets users based on demographic and behavioral profiles. Financing options, payment plans, buy now pay later schemes specifically for cosmetic procedures, have made surgery accessible to income brackets that previously could not consider it. The democratization of elective cosmetic procedures is real. Prices have fallen for many procedures as competition has increased. More people can access the technology. Whether that is an unambiguous social good depends entirely on whether the demand driving that access is genuine autonomous preference or manufactured insecurity monetized at scale. That distinction is genuinely difficult to draw. Possibly impossible. By algorithms, advertising, and a culture that quantifies attractiveness in likes and followers does not have a clean answer. The global aesthetics industry is betting that most people will not ask the question carefully. The evidence, $67 billion in annual revenue and climbing, suggests that bet is paying off. So here is where we land. A $67 billion industry. Growing at rates that outpace most healthcare sectors. Serving genuine reconstructive medical needs and elective aesthetic preferences simultaneously. Operating across regulatory frameworks so varied that the same procedure carries vastly different safety standards depending on geography. The surgeon in Seoul who sees 3 consultations a day, each patient carrying a photograph of someone else's face, is not an outlier. She is the market signal. Rather than finance, is this. The demand for that technology is shaped by systems designed to make people feel inadequate. Who exactly is making